All right, I'm joined by Dr. Robert Wachter, who is the chair of the Department of Medicine at UCSF. Dr. Wachter, really good to have you on here. You made sort of an interesting prediction, I suppose you could say, that if the entire country had sort of followed the same model as San Francisco when it came to closing down due to the coronavirus, that there would be 50,000 deaths in this country as opposed to the more than 200,000 deaths that we've seen. What do you base that on?
Well, that's just math. That is when you take the deaths per population of San Francisco, and if you extrapolated that to the entire United States, we'd be around 45,000 deaths in the United States as opposed to about 225,000. So more than 150, maybe 160,000 lives would be, people would be alive if the country had mirrored our experience in San Francisco. Of the 20 largest cities, we have by far the lowest per capita death rate.
Okay, so what did San Francisco do right in your eyes?
I think we did a lot of things right. The political leadership, I think, has been spectacular. I think the mayor, the city health director, the other leaders of the city have done a wonderful job in communicating clearly, giving us good news, giving us bad news, making it clear what we need to do in order to stay safe. I think the corporate leaders have also been terrific. If you think about it, it was the Googles and the Twitters and the Facebooks that told people to stay home 2 or 3 weeks before the city did in late February, early March. I remember when I heard Google tell people to stay home, that was the moment I said, wow, this must be serious stuff because they're smarter than I am. They think this is.
I remember that moment too, actually, yes.
I think the third thing, and this it can't be minimized, is the people. We've had people have generally believed the science. You don't hear people in San Francisco say this is a hoax. You don't see people marching on City Hall saying it's time to open up. I think people generally understand what the threat is and how serious it is, and they've been acting very, very well. And I'd say the fourth thing is we've gotten lucky. We have not had any huge super spreader events, maybe other than San Quentin Prison. But for example, Laguna Honda, could have been terrible, 1,000-person nursing home. There were a few cases there. We marched in and shut that down, and nobody died there. So all of that has come together. I hope it stays that way. That's no guarantee of future success, but at least so far we've done amazingly well.
All right, some people might look at it and they might say, well, it's a lot easier for people in San Francisco. There are a lot of well-to-do people in San Francisco who have the ability to be able to stay at home when there's lockdowns in place, to be able to work from home. And maybe in other communities, other cities, they're not able to do so quite as much. What do you say to that? That sort of leads to some of the success we've seen in controlling the virus.
Probably a little bit of truth to that. San Francisco has certain natural advantages. First of all, we're seeing it now that people don't have to be indoors because it's not that cold. It's a reasonably well-to-do city, although there are plenty of people who are essential workers. And when you go to the grocery store and you go to the laundry and you go to other places, there are people there working. And we have seen disparities in San Francisco where there are more cases in the Mission, for example, than in other parts of the city. But even the Mission, it's a tiny fraction of what you would have seen in a comparable neighborhood in New York or in Phoenix or in Houston. And then when you look around the whole Bay Area has done quite well. And certainly if you go in Alameda or other parts of the Bay Area, there are a lot that we have a very, very diverse community. There are lots of poor people. I do think the fact that the tech sector is such a big deal in San Francisco is a mild advantage because those folks quite easily could stay home. But for the rest of it, it's a big, diverse, complex city where we're the second densest city in the country. People always think, oh, the reason you did so well is it's not dense like New York. We're number 2 after New York. So I think most of it was doing the right thing rather than natural advantages.
Okay, lastly too, I want you to sort of key in on this idea that San Francisco, the public health officials in San Francisco, have had a lot of success dealing with similar public health crises, such as the pandemic here. We have a long-standing relationship between public health officials in the city and county of San Francisco and public universities like yours. How important has that relationship been?
Yeah, no, I think the relationship, first of all, the quality of the San Francisco Department of Public Health is unparalleled. It's a general consensus in the world of public health that this is as good as it gets. They're smart, they're data driven, they're really terrific communicators. I'm very proud of a lot of them. Many of them were trained at UCSF, so both Grant Colfax and Thomas Aragon, who are the two key health leaders for the DPH, were residents of mine during their training. But much more importantly than that, there has been a long-standing, very fruitful collaboration between the Department of Public Health and UCSF. It's always been good. It really was cemented during the early years of the AIDS epidemic, where it was truly the Department of Public Health and UCSF coming together to figure out how to come up with guidelines, how to engage the community, how to use data effectively, how to do public health and also do research at the same time so we could learn from our experience and get better and better. And that relationship from the early years of HIV in the mid-1980s to today has led to, I think, really an unmatched collaboration between a university and a public health department. And so when the city said, we need some help with Laguna Honda, UCSF came in and helped. When the city said, we need to expand testing beyond what we can do, our faculty and trainees at the Chan Zuckerberg Biohub did all-nighters for a couple of weeks to develop testing capacity, which they then made available not only to the city, but to other hospitals and health systems throughout the Bay Area. So it's been a wonderful collaboration. And I think this has been, we've seen the benefits of that play out over the last 6 months.
Okay, finally here, Doctor, and then I'll let you go. But looking forward here, obviously San Francisco is well positioned right now, especially compared to the rest of the country, where as you know, we're seeing cases surging in so many states. How do you avoid getting complacent and backsliding?
That's the biggest risk. I mean, the biggest risk is success. that people feel like we've done so well, we're okay, we don't have to worry about it. I don't think that's going to happen here. We could have seen it in June. We started to see a pretty big surge in California. The mayor came out, the health director came out and said, folks, this is serious stuff. We could lose all of the gains we've had, and people turned it around. It was interesting because in San Francisco during that period, we had a few dozen deaths. In Los Angeles, they had several thousand. So not all of California turned it around, but in San Francisco, they did. So I think we're going to be, unfortunately, we've seen this movie before. There's going to be a surge all over the place. California is beginning to bump up a little bit. I'm worried about it. I will not be surprised if you see the mayor and the health director come out in the next couple of days and say, folks, if we're not careful, we could be like all of the rest of the country. And the fact that we've done well in the past is zero guarantee that we'll do well in the future. But at least so far, what I've seen is I would have confidence that we would keep it at bay the way we have so far.
Yeah. All right. Certainly on the right track in San Francisco. Dr. Robert Wachter, Chair of the Department of Medicine at UCSF. Really appreciate you taking the time.
Thank you, Alex. Appreciate it.
All right. Take care.